Welcome to Quality Insights Quick Start QAPI resources that are designed to help you get any performance improvement project up and running quickly. Julie Kueker, the Reducing Healthcare Acquired Conditions in Nursing Homes Network Task Lead, will review a topic-specific Quick Start guide. Today's topic that we're going to take a look at is pain management. And at this time, I'd like to turn the session over to Julie.
Thank you, Krista, and thank you very much for attending this session to help you quick start your pain management performance improvement project for QAPI. It's very important to start that pain management process because, according to the CDC, about 1/4 of all nursing home residents report or showed signs of pain. 44% of nursing home residents with pain received neither standing orders for pain medications nor special services for pain management. And this can be especially true during therapy services. Pain is common among nursing home residents, and effective pain management has an impact on improving the quality of life. So how to make this QAPI performance improvement project on pain? How are we going to begin? Well, typically most projects contain these three elements: a root cause analysis, setting a stretch yet attainable goal, and an action plan to improve, including a plan for sustainability. We're going to go through each one of them step by step. So at first, to get started, you need to choose that good multidisciplinary performance improvement team members, which could include frontline staff. They have an important piece to this puzzle. They know that resident inside and out, and they can tell you quickly when they feel a change of condition on pain has occurred. This project also is very powerful if you include the resident and family members. The resident, because they'll give you exact feedback on your assessment tools. Do they feel they are effective? The family members, do they feel like the pain management program that their loved one is on is effective and working? They can help guide you through these improvement process. Physical therapy activity staff, key clinical staff are also great multidisciplinary team members. And of course, having that good leadership on board. Now, before that first meeting, you'll want to gather your baseline data and that initial project information. You have to know where you're going to know how to set your goals and improve. So you need to have on hand your most current CASPER report. And always remember, for your pain management quality measure, you'll find on your CASPER report a column that says adjusted percent. Always make sure to use that column for your pain management quality measure because there are some statistical management and statistical adjustment behind the scenes. Also have on hand your resident roster mix report. Your NDS coder can also run this as well as your CASPER report for you. This will tell you which of your residents are in the numerator for your pain quality measure. You may want to have on hand therapy and medication reports and be prepared that you may need to do some chart review to do that nice deep dive into your system processes to see why your pain management score is high. The team will probably want to meet monthly to make sure that you reach your goal and review this data monthly as well. So step one, let's go into that root cause analysis. This is where you keep asking why until you have identified the real cause to the problem. An essential piece to any performance improvement process does include a root cause analysis because it reviews all the details to the problem. All staff members need to provide input, and this also has the side effect of providing empowerment to where they have ownership of this quality project, where they have a hand in its success, and this plays right into sustainability. Make sure to always focus on the process, not people, when you are doing your root cause analysis. Now, Quality Insights does provide you a couple of great tools which you can choose from to accomplish your root cause analysis. The first one is the 5 WHYS tools, and it's pretty simple to use. You state your problem, that specific problem that you're wanting to review, and you keep asking yourself why until you get to that very bottom root causes that you feel are playing a part. At that point, you can design successful implementation and improvement strategies to work on what you have identified as the root cause. Another tool that we can provide to you is the fishbone diagram. It may look a bit complicated, but it's actually just as easy to use as the 5 whys. What most people do is during the course of using this fishbone, at the very first meeting, they'll go around the room and they'll take everyone's ideas down on why they feel like this pain management project, why the scores are high, and you'll capture everyone's ideas in this brainstorming session. You'll go back to your office or your workspace and you'll put all of that information on the fishbone. And remember, there's no right answers or wrong answers. There's just your answers. And the reason why the fishbone can be so effective, because it clearly states and it's a visual depiction of all the causes you have identified that might be behind the high rate, allowing you to focus and developing a improvement plan specific to what you have identified. There may be several causes to the problem that you'll want to review through the course of the project, and it also helps you prioritize which items to be solved that would have the most direct and positive impact for your residents. Step 2 is setting that great goal for your QAPI. And remember, goal setting is important because you can quantify a measurable improvement result without guessing if you have gotten any better. It should be a stretch goal, yet attainable. And it should be clearly stated and describe what you intend to accomplish. Now, these goals are best if they are written using the SMART formula, meaning that it's specific, measurable, attainable, relevant, and time-bound. And one of the tools that you can use, this goal-setting worksheet found in the QAPI at a glance document, you have the web address listed below on this slide. That if you use this goal-setting worksheet, the SMART formula is just built right in through the course of answering your questions. You will be utilizing that SMART formula right out of the gate. So let's look at an example. Now remember, for these examples, you will find my email address on the very last slide of this program. And utilize that email address so you can order for yourselves the blank documents as well as my example documents that you see before you. In this example that I provided for a goal-setting worksheet, you will see that this sample nursing home wants to improve their pain quality measure by 30%. Their current rate is 8.4, and they want to decrease it to 5.9 in 6 months. And there's your time bound. And why is it relevant and attainable? What best practices did we use to compare ourselves to? And so utilizing this goal-setting worksheet has that SMART formula built in for you. Now that we have set our goals, we're going to move on to that action plan for improvement. And remember, it needs to be based on that tried and true problem-solving model of plan, do, study, act. So let's plan. So first we need to understand the quality measure by which we are demonstrating our improvement. How do we get that CASPER number? Where does it come from? How does this eventually turn into the public reported measure of 5-star? I have here the one sheet that comes from the NDS Quality Measure Technical Manual. The address to this is, and the exact manual is found on our My Quality Insights webpage. But once you pick this as an improvement project, you need to understand how this quality measure works if this is what you are using to document your improvement for this project. First, you need to know it has a 5-day look-back period. So how you're answering these questions on the MDS, your MDS coder is looking back 5 days, and she is seeing if any of these residents have documented a moderate to severe pain has been self-reported. This pain interview must be attempted on all residents. Admission assessments are excluded, and this is a really good tip that could be at the heart of why your pain management scores could be high. Are you using the correct assessment tool that matches the cognitive ability of the resident? Because when it comes to pain assessment tools, it very well could be that one size does not fit all for your residents. We want to provide you here at Quality Insights with great tools to help you improve. This is one of them. This will allow you to do that really good process deep dive and to understand why your pain management quality score could be high. This has you actually look at each one of these residents who are in the numerator of your quality measure, looking for things such as, are they on a PRN pain management that could be driving your rate? Are we using the correct assessment? Are they being scanned appropriately? Are we missing opportunities such as having your CNA screen for pain at every shift? Is this a must-fill screen in your electronic health medical record? These are the type of questions that you'll find when you utilize our tool that's going to give you an idea of where your interventions might need to be. Another tool that you'll want to bring with you from your team meetings from time to time is your 10 ways to improve your pain management score. Good tips on making sure that your physician is on board, knowing your residents, making sure that you're looking on how these orders are being placed for this pain management. Is it PRN? Should they be changed to regular scheduled? These are these great questions you'll want to review in your team improvement meetings to make sure you have covered all the particular elements that might be driving your high rates. Another tool that you'll want to take advantage of that we can provide to you is you have to demonstrate your action steps for improvement. We have a sheet already built in that covers this PDSA improvement cycle. Now, in the particular example you see in front of you, the data source does come from the Casper measure, which responds fairly quickly and pretty quickly to all of your improvement activities, totally appropriate to use this to track your improvement. But you may also want to do some internal data tracking. Maybe you want to have % of residents with that daily CNA pain screening assessment. You want to make those % of residents who receive appropriate pain treatment before therapy. Maybe that's an internal data tracking measure that you want to target to show that your processes are improving. And don't forget to take advantage and document all of your action steps. Maybe you are reviewing your current policies to best practices. You're going to do a chart review of those residents who are in the numerator. You're working with your medical director on those residents who have a PRN pain management order to see for appropriateness, and you're going to discuss that in your improvement meetings. This is a great tool and a very quick and easy tool to document your improvement through the life of the performance improvement project. Here are some questions for your team as you're starting this project. What does your staff really believe about pain when it comes to your residents? Do they think the residents are in pain to get attention? Do they think elderly, they just have a higher tolerance for pain? And besides, it's a normal part of aging. It's to be expected. Or maybe it means death is near. Instead, maybe we could change the mindset to understand that pain is actually interpreted by the individual. There are no biological markers for pain. Self-reporting is the most accurate evidence of pain. And pain is whatever the resident says it is. So here's some tips to make your pain improvement project successful, especially when it comes to communicating with that dementia resident. Those are the ones that may be a little tougher to be able to elicit that information of where exactly their pain is. And remember, there are some pain tools out there specifically designed for this dementia resident. You'll want to call that person by name, look them in the eye, even if you have to bend down if they're in the wheelchair, to make sure that you are at eye level. Use simple words said slowly in a soothing tone. Ask one uncomplicated question at a time, and most importantly, wait for the answer. Give them patience. Try some non-pharmacological alternatives, maybe warm blankets, music, and not just what we like. Make sure it's the kind that they enjoy listening to. Pet therapy, yoga, exercising, stretching, or maybe that good shoulder massage at the spa time. Don't forget to graph your improvement over time. In the example that you see here, you'll see that our Sunshine Nursing Home has a nice drop, achieving their goal in that good 6-month time period when they had that really great improvement going on. And also remember, on My Quality Insights, our webpage, you can download your reports that are uploaded monthly, and all you have to do is hit print, and you will have that improvement graph right there in front of you. If you need help with gaining access to your My Quality Insights webpage, make sure to email me using contact information you'll find on the last slide, and I'll make sure that you have your full access to My Quality Insights so you too can download your graphs of improvement. So in conclusion, if you use the following principles, you'll be able to target areas to improve for your pain management performance project. Always make sure that you ground your work in that QAPI process. Educate all staff, this means all shifts, in this improvement process. Remember to focus on the system processes, making it easy for changes to have that good positive impact. For example, making a force-filled screen on your electronic health record that your CNA must fill out every shift for her impression of that screen of pain management. Perform a root cause analysis, because you will refer back to it from time to time, especially if your project is not improving at the rate to which you feel it should. You can always pull that document out to see if you are missing an important piece. Set a stretch goal for improvement. Implement plan, do, study, act cycle. Monitor process change to secure improvement, and learn from your challenges, and most importantly, celebrate those successes. Don't forget to reach out to your quality improvement project coordinator for assistance in getting this and any other topic started for your QAPI. Sustainability is important in any project, because once you've reached your goal, it's important to continue to monitor and educate to sustain those gains, to celebrate those successes, to reward the hard work of improvement in your nursing home. QAPI at a glance in those documents does contain a sustainability decision guide. It would be my recommendation that you print this out and also include that in your QAPI binder so you can make sure that you keep those great improvement gains that you made through your hard work of this project. Here are some resources that you're going to find that you're going to want to take advantage of to compare yourself to best practices. And if you have any questions that through the course of this education, if you would like those blank documents, if you would like my example documents, and you want to reach out to me for access to my quality insights or just to get started with your quality improvement project, please take note of my email address on this slide and let me know. It would be our pleasure to help you with this project. Thank you very much for your willingness to work on a quality improvement journey that we know will impact the lives of the residents to which you serve. Thank you very much.